Elopement. In a clinical setting, it refers to when a patient leaves a psychiatric facility without permission or supervision, often tied to serious mental illness or a diminished ability to make safe decisions. The Guam Legal Services Corporation Disability Law Center is calling out the Guam Behavioral Health and Wellness Center, accusing the agency of failing to address practices that have allowed these incidents to happen repeatedly.
This isn't a new issue for us. We've been talking about this for months, about their intake process. And unfortunately, they continue to do it. And this last 6 months, we're seeing the negative consequences of it.
Executive Director Attorney Daniel Summerflex says there have been 5 elopements from the center since the start of this year, despite the individuals being determined a danger to themselves or others or considered gravely disabled.
They're not brought there because everything's great. They're brought there by family members, by police officers, by airport police, because they are showing signs of serious mental illness or behavioral issues. In one situation, the individual was locked out. They wouldn't let him back in. So he left.
Summerfleck also pointing to an apparent lack of dignity in the intake process, noting that individuals are often left outside under a pavilion while awaiting commitment.
Anyone driving by can see that person with their intake going on. So I find that very objectionable, that it does not provide privacy or confidentiality to someone that's in emotional trauma.
He says his law center has been meeting with the agency for months, but there has been no meaningful change. This after GLSC-DLC discovered the Behavioral Health Center lacks specific policies and procedures or written guidance in place to prevent or respond to elopements, grave issues that he says can have serious consequences, including injury or even death. And while Summerflex says the lawsuit isn't on the table yet, with ongoing efforts to resolve the issue, legal action isn't completely off the table either.
We've now brought the issue to the public. Hopefully the issue will be corrected, and if not, then we'll start looking at our options as far as litigation is concerned.